The title of this presentation is Dementia Training for Community Health Workers. This presentation was created by the Minnesota Community Health Worker Alliance with the Minnesota Department of Health. Firstly, hello and welcome to the training. We're happy you're here to learn about this very important topic. My name is Shawn McKinney, and I'm a community health worker. I will be your trainer for this module. Like you, I'm a frontline health worker, and we play a key role in the prevention and care of dementia. Let's begin the presentation. There are 5 modules in this training. The introduction is 30 minutes in length. Risk reduction is 40 minutes. Dementia detection is 15 minutes. Living with dementia is 20 minutes. And finally, caregiver support is 30 minutes. The targeted audience for this training include community health workers, CHWs, community health educators, patient navigators, community care coordinators, promotores de salud, and other similar roles. We would like to acknowledge the Minnesota Department of Health, Health Promotion and Chronic Disease Division, and the Minnesota Community Health Worker Alliance for creating this training. It was made possible through a grant from the U.S. Center for Disease Control and Prevention. There are 6 main learning objectives for this training: to understand dementia as a public health issue, increase one's knowledge of dementia risk reduction, encourage early diagnosis of dementia and related conditions, increase prevention and management of the disease and avoidable hospitalizations, provide suggestions for caregiver support, and lastly, to discuss cultural sensitivity and the role of the CHW within each of the above objectives. Throughout this training module, there will be a case study with questions for each of the sections. The first case study states that Nina, a 30-year-old woman, has started to notice that her 68-year-old father, Jerome, has been becoming more forgetful over the past few months. He has always been someone who misplaced items, but she's beginning to worry it's more than that. Jerome takes care of himself and generally seems to be doing well, but he doesn't like going to the doctor. He has diabetes and is a little overweight. Nina worries about what to do next and what happens if her dad does have dementia. Let's start the first module, Introduction to Dementia. The introduction topics that will be covered include dementia as a public health issue, the causes and types of dementia, diagnosis and treatment, signs and symptoms, cultural humility, and lastly, the role of the CHW. How common is dementia? In 2018, it was estimated that 5.7 million people in the United States had Alzheimer's disease and related dementias. Of those 5.7 million, 5.6 million were age 65 and older, while around 200,000 were under the age of 65 with younger onset Alzheimer's. In 2018, over 94,000 older adults were living with Alzheimer's in Minnesota. Dementia is a serious public health and health equity issue. By 2060, the number of Alzheimer's disease cases is predicted to rise to an estimated 14 million people. Populations that are under-resourced and people affected by the social drivers of health will be impacted the most. Alzheimer's cases among Hispanics will increase 7 times over today's estimates, while cases among African Americans will increase 4 times over today's estimates. These findings are the result of structural inequities within our society. This increase in dementia cases will greatly impact the health system. Currently, there are 55 million people living with dementia worldwide. It's likely that this number will double every 20 years. There are over 10 million new cases each year, and a new case being diagnosed every 3.2 seconds. In 2022, dementia cost the United States $321 billion, and by 2050, It could cost the country up to $1 trillion each year. By 2050, Minnesota must increase the amount of doctors that care for the aging population by 221.4%. And by 2028, the number of home health and personal care aides must increase by 29.7% in order to meet the rising demand. Next, let's cover what is dementia. Dementia is the growing loss of cognitive functioning that interferes with a person's daily life. Cognitive functioning is the mental process of knowing, which includes awareness, perception, reasoning, and judgment. Signs and symptoms appear as the nerve cells in the brain stop working, lose connection with other cells, or die. Dementia is a progressive disease, meaning it grows and changes over time. Dementia becomes more common as people age, but it is not a normal part of aging. Dementia is caused by damage to cells in the brain, causing the inability of those damaged cells to communicate properly with each other. Currently, we do not know the cause of dementia. Some forms of dementia may have a genetic component. Since we do not fully understand all the causes of dementia, this is a barrier to slowing or stopping it. There are many types of dementia, including Alzheimer's, vascular, Lewy body, frontotemporal, Huntington's, and other mixed dementia. Each of these will be detailed in the following slides. It's important to note that dementia is an umbrella term for loss of memory and other thinking abilities severe enough to interfere with an individual's daily life. Symptoms and the causes vary depending on the type of dementia. There is a difference between mild cognitive impairment, or MCI, and dementia. MCI is an early stage of memory or other cognitive ability loss in individuals who maintain the ability to independently perform most activities of daily living. The visual on the right shows some differences with dementia and MCI. With MCI, they may have a more difficult time solving complex problems or making decisions, and may have difficulty performing more than one task at once. Dementia may cause an individual to have personality changes, paranoia, and have difficulty with planning and organizing. Individuals with MCI do have a higher chance of developing a type of dementia. Some individuals with MCI may go on to develop dementia, others do not. Let's move on to the types of dementia, starting with Alzheimer's disease. It is the most common type of dementia. It is often diagnosed when an individual is in their mid-60s, but has been seen in people in their mid-30s and up. Alzheimer's is caused by the abnormal buildup of proteins in the brain. Over time, symptoms range from mild, such as wandering and repeating questions, to severe, resulting in an inability to communicate. Vascular dementia is often diagnosed in individuals over 65. It is caused by conditions that damage blood vessels or interrupt blood and oxygen flow to the brain. Examples of these conditions include strokes and some cardiovascular diseases. Symptoms of vascular dementia include forgetting current or past events, trouble learning, misplacing items, poor judgment, and hallucinations. Next is Lewy body dementia. This type can be difficult to diagnose and occurs mostly in those over 50 years old. It is characterized by abnormal deposits of a protein in the brain. It leads to problems with the person's thinking, movement, sleep, behavior, and mood. Frontotemporal dementia is a rare form of dementia. It is often diagnosed in those 45 to 65 years old. It is associated with abnormal amounts or forms of certain proteins in the brain. Symptoms of this type include movement and language problems, along with changes in a person's behavior and emotions. Mixed dementia is when people have more than one type of dementia. It's also important to note that there are other conditions that cause dementia or dementia-like symptoms. These include normal pressure, hydrocephalus, stress, anxiety, depression, and delirium, argyrophilic grain disease, Creutzfeldt-Jakob disease, Huntington's disease, chronic traumatic encephalopathy, HIV-associated dementia, and Parkinson's dementia. The signs and symptoms of dementia vary based on type or phase. Some of the symptoms of an individual with a type of dementia may include memory loss, poor judgment and confusion, difficulty speaking, understanding, and expressing thoughts or reading and writing, wandering and getting lost in a familiar neighborhood, trouble handling money responsibly and paying bills, repeating questions, using unusual words to refer to objects familiar to them, taking longer to complete normal daily tasks, losing interest in normal daily activities or events, hallucinating or experiencing delusions or paranoia, acting impulsively, not caring about other people's feelings, and lastly, losing balance and problems with movement. When trying to find a diagnosis, it is important to rule out other conditions that may cause cognitive difficulties. Reviewing each individual's personal and medical history is key for this. There may be multiple different tests that may need to be done to diagnose a person with dementia. There are various screening tools that can be used in communities to indicate if a medical assessment is needed. Moving on to treatment. Since there is no cure for dementia, the main goal of treatment is to delay progression of the disease and preserve the individual's quality of life. There are a few medication options approved for this treatment of various symptoms. However, treatments should be thoughtfully considered as they can come with adverse side effects. There are therapies and non-medical interventions available, such as occupational therapy, modifying environments, and simplifying tasks. They all may help individuals with dementia. Keeping cultural sensitivity in mind while working with individuals with dementia is important. It's critical to understand how the social drivers of health serve as risk or protective factors for dementia. Making sure to understand our own personal and subconscious biases is key to successfully working with patients for dementia care in an equitable manner. Taking time to learn about the patient's life experiences, practices, and beliefs will help improve their quality of care. Showing respect and making sure to put people at ease and taking time to establish a relationship in a way that is culturally sensitive and appropriate for them will help their quality of care. Lastly, focus on using the strengths and protective aspects of a culture when caring for a person with dementia. CHWs do have a role when it comes to treating dementia. When an individual or family is questioning whether aging is healthy or not, the role of the CHW is to assist people to find and understand information about dementia and access testing. During this process, be a knowledgeable resource as individuals and families begin to investigate symptoms and raise questions. Assist the client and the family with access to cognitive and neurological tests. It's also important to connect clients with culturally appropriate resources to help them understand dementia and plan for the next step. Here's a short video that's going to discuss what dementia is, how it impacts the brain, and the causes of dementia.
Dementia is a word we give to a set of symptoms affecting different aspects of thinking and brain function that get worse over time and affect the way we live our lives. Dementia is not a normal part of aging. It is the result of physical diseases that damage the brain. Everything that makes us who we are, our personalities, intelligence, emotions, our hopes and our fears are driven by this incredible organ. The brain is the most complex structure in the known universe. Intricate networks of brain cells, bundles of nerve fibers, and hundreds of miles of blood vessels all work in careful unison to keep us ticking every day. Every second of our lives, nerve cells in the brain are firing. But when these cells become damaged and their connections start to break down, a person can develop dementia. The area of the brain where this damage occurs determines the symptoms a person experiences. If nerve cells in the back of the brain are damaged, a person's vision might be affected and they may have trouble reading words or climbing stairs. If nerve cells in the side of the brain are damaged, communication and language skills can change. There are 4 main diseases that cause dementia. The symptoms of these can overlap, sometimes making them difficult to tell apart. While each disease has characteristic symptoms, these can change from person to person depending on which areas of the brain the disease is affecting. Alzheimer's disease is the most common cause of dementia. Often, one of the first areas of the brain to be affected by Alzheimer's is the hippocampus. The hippocampus controls aspects of our memory and navigation. So, forgetfulness and getting lost are usually some of the first symptoms of Alzheimer's. In Alzheimer's, nerve cells are damaged by a buildup of 2 proteins in the brain, amyloid and tau. These proteins are present in all of our brains, but in Alzheimer's they behave unusually and begin to clump together. Researchers are still trying to understand what triggers this, but it's likely to be a mix of age, genetics, and other factors such as poor heart health. The buildup of harmful proteins is also a key factor in other diseases behind the condition, like dementia with Lewy bodies and frontotemporal dementia. This damage spreads from one area of the brain to another as the condition progresses. So symptoms get worse over time and people begin to find more aspects of day-to-day life difficult. Dementia with Lewy bodies can affect different areas of the brain, leading to a variety of symptoms including changes in attention, sleep problems, and hallucinations. The processes involved in dementia with Lewy bodies are similar to those involved in Parkinson's disease. And people with dementia with Lewy bodies can also develop Parkinson's-like symptoms such as shaking and slowed movement. Vascular dementia can occur after someone has had a stroke or the blood vessels in their brain are in poor health. While the other diseases that cause dementia spread steadily through the brain over time, vascular dementia can progress in distinct steps after an event such as a stroke, slowing a person's ability to think, plan, and pay attention. Unfortunately, there is currently no cure for any of the diseases that cause dementia, and no treatments that can slow or stop the spread of these diseases through the brain. Researchers all over the world are looking for new ways to tackle these diseases and protect precious nerve cells. Their work has the power to offer new hope to millions of individuals and families whose lives are affected by dementia. To find out more, search Alzheimer's Research UK.
This is the case study from earlier in the presentation. Let's review it again. Nina, a 30-year-old woman, has started to notice her dad, Jerome, a 68-year-old man, has been becoming more forgetful over the past few months. He's always been someone to misplace items, but she's beginning to worry it is more than that. Jerome takes okay care of himself, but doesn't like going to the doctor. He also has diabetes and is a little overweight. Nina worries about what to do next and what happens if her dad does have dementia. So Nina has started doing some reading on dementia and didn't realize how many different types of dementia there are. She now feels she knows a little about the signs and symptoms as well as the progression of dementia, but still has questions about what the future holds for her family. She has decided her father may need to be seen by a medical professional to be assessed. She has not talked to Jerome about this. If Nina came to you for help, What information could you, as the CHW, share with her and Jerome about seeking a medical provider? What next steps would you recommend? Think about information you might share with them about dementia, the diagnosis process, and treatment options. Please stop this PowerPoint and take a few moments to think through and write down the answers to these questions. Let's move on to a few knowledge check questions. True or false? The goal of dementia treatment is to cure the disease. That's false. There is currently not a cure for any type of dementia. The goal of treatment is to slow the progression and increase quality of life. What are 3 symptoms of dementia? If you said any of these, you are correct. Experiencing memory loss, poor judgment and confusion, difficulty speaking, understanding, and expressing thoughts, or reading and writing, wandering and getting lost in a familiar neighborhood, trouble handling money responsibly and paying bills, repeating questions, using unusual words to refer to familiar objects, taking longer to complete normal daily tasks, losing interest in normal daily activities or events, hallucinating or experiencing delusions or paranoia, acting impulsively, not caring about other people's feelings, and losing balance and problems with movement. Moving on to the final knowledge check question. What type of dementia is the most common? The answer is Alzheimer's disease. 6.5 million Americans have Alzheimer's. That means about 1 in 9 people over 65 have Alzheimer's. The 3 biggest takeaways from the introduction include: number 1, dementia is a growing public health issue. 2, the role of the CHW at early stages is to assist families find and understand needed information and access testing. And number 3 is a link to the Alzheimer's Association website for the Minnesota and North Dakota chapter. Make sure you keep this link as part of your CHW resources. This includes their phone number and other helpful resources. Thank you for listening and for learning how you can help clients facing dementia. I've enjoyed spending this time with you. This is the end of training module 1.